This is Dr. Kushal Shah. I'm reviewing the evaluation and treatment of C2 fractures and instability. This PowerPoint accompanies the book chapter in Yeomans and Wynn Neurological Surgery, 8th edition. The objectives of this talk today are to understand the classification of odontoid fractures. Also, appreciate the available treatments for the various odontoid fractures, including type 1, type 2, and type 3. Additionally, we will review Hangman's fractures and how to best manage them. 10 to 20% of all cervical fractures involve the axis. It is not uncommon for there to be additional fractures when a C2 fracture exists. The most common type of C2 fracture involves the dens, and of those, 70% of them are type 2 odontoid fractures. Hangman's fractures are bilateral traumatic spondylolisthesis through the pars interarticularis. There are additional C2 fractures involving the facet, body fractures, and miscellaneous fractures. These will not be reviewed in the PowerPoint here, but additional information is available in the actual textbook chapter. The classification of odontoid fractures was popularized by Anderson and D'Alonzo in 1974, who are responsible for developing the most common classification system. Type 1 fractures are oblique fractures that go through the upper part of the odontoid process or tip. Type 2 fractures are fractures that involve the junction of the odontoid process and the body. These are the most common and account for more than half of all odontoid fractures. Lastly, type 3 fractures are fractures that extend down into the body of C2. This diagram demonstrates the various types of odontoid fractures. Pictures on the left are from the original classification system. The pictures on the right are a modification that has been made to the classification system. As you can see, on the left, type 1 fractures involve the tip of the odontoid process. Type 2 fractures, also the most common, go through the base of the odontoid process. Type 3 fractures involve the body of C2. Type 2 fractures are then subdivided into 3 subtypes that are demonstrated on the right side. Subtype A is a type 2 fracture with minimal displacement of less than 1 millimeter. Subtype B is a type 2 odontoid fracture with greater than 1 millimeter of displacement. Subtype C is a type 2 odontoid fracture with significant comminution. Treatment of odontoid fractures is largely dependent on the type of fracture as well as the displacement. Type 1 odontoid fractures tend to heal very well with external orthosis. Type 2 odontoid fractures are the most controversial in terms of treatment. Healing rates in collars are anywhere from 53 to 57%, or in a halo of 70 to 74%. However, type 2 odontoid fractures sometimes need surgical intervention. This can be done through an anterior odontoid screw or posterior surgical fixation and fusion through a number of various treatment options. These surgical treatments are detailed in the book chapter. Type 3 odontoid fractures, similar to type 1 odontoid fractures, heal well in external orthosis with healing rates from 87 to 100%. Hangman's fractures are bilateral fractures of the pars interarticularis. They typically occur from a traumatic injury that results in hyperextension and axial loading of the neck. It is uncommon for neurologic sequelae to occur from a Hangman's fracture, and the most common symptom is neck pain. Most Hangman's fractures are treated with external immobilization with healing rates greater than 93%. In conclusion, Odontoid fractures are the most common axis fractures. Type 2 are the most common odontoid fractures. Various subtypes exist that were reviewed previously. The treatment of these type 2 odontoid fractures is controversial and includes the options of external orthosis with a brace, haloimmobilization, anterior odontoid screw, and posterior fusion. Hamgen's fractures are generally best treated with external orthosis alone. If you'd like more details of any of these topics covered in this PowerPoint, please review in the book chapter in Yeomans and Wynn Neurological Surgery, 8th edition. Thank you.